Good afternoon. My name is Haley Sumner, and I'm a nurse practitioner student with Auburn University. And today we're doing a health history intake on my mother. So I'm going to let you tell me your name, date of birth, and your relation to me.
I'm Janice Sumner. I was born 9/1/51, and I am Haley's mother.
Okay. We're going to start off talking about childhood. So have you had any childhood illnesses that you remember as a child?
I don't remember it, but I was told I had measles, chickenpox, and I think I had mumps.
Okay. Did you have any, or do you have any chronic illnesses?
I do not. I had osteopenia probably 15 years ago. I was diagnosed, and I took Fosamax for a couple of years and maybe 3 years, and that kind of cleared itself up, and I have not had to take any more medication for that, and it never developed into osteoporosis.
Okay. And have you had any prior illnesses as far as like acute illnesses or hospitalizations, accidents, anything like that before?
No accidents, no hospitalizations other than childbirth 4 times, and I don't have any other hospitalizations or accidents, no major accidents or problems.
And then any surgeries before, any past surgical history?
The only surgery I had was a minor surgery to remove basal cell carcinoma on my back, and that was probably 10 or 12 years ago.
Okay. And then moving on to like your current health status, how would you describe your, or how do you perceive your health? Would you say it's very good, excellent, fair, poor? How would you describe your health?
I would say good, not excellent, but good.
Okay. And then are you allergic to anything? This is environmental allergies or medication allergies that you know of?
No medication or environmental allergies that I'm aware of, no.
Okay. Do you take any daily prescription medications?
No prescriptions. I do take vitamins.
Okay.
I take C, D, calcium, B12, and a couple of other supplements, the red yeast rice and Cholestoff to assist with keeping cholesterol low so I don't have to resort to medication.
Okay. And then any over-the-counter medications that you take? Do you take any?
On occasion, if I have a sinus infection, I might take an antihistamine, but I don't like to take those because they dry me out so badly. But if I have a headache or body aches, I might, once in a great while, I might take an Advil or Tylenol or something like that, but not on a routine basis.
Tobacco use, have you ever been a smoker or any kind of tobacco use? Do you dip snuff?
I did not dip snuff. I did not smoke cigarettes, and I am not currently a smoker and have not done drugs, although I grew up in that era when it was very rampant in the late 60s. But I do have mild secondhand smoke from my husband. He smokes outside. He does not smoke in the house, but when he comes in, I can smell it on his clothes.
Yeah. Any no recreational drug use?
No, ma'am.
Okay. And alcohol?
No alcohol. I'm teetotaler.
Okay. And then any environmental hazards? Can you think of anything that you would work around or live around that would be a hazard to your health?
No.
Okay. And safety issues or safety measures rather, do you have, that would be things like smoke detectors, CO2 detectors. Do you have any of that present in your home?
Do not have CO2 detectors, but we have smoke detectors in the house.
Okay. And tell me about any exercise that you do. Tell me about what you do for exercise and how many days a week do you go, or how often do you go, and about how long you spend when you do exercise.
I have recently gotten back on an exercise regimen, and I go to the gym about 3, sometimes 4 times a week, and I stay for at least an hour, sometimes an hour and 10-15 minutes. But I do weight bearing machines as well as floor exercises, some weights on the floor as well. But that's my exercise practice, and I walk on the treadmill or walk out in nature for 20 to 30 minutes.
Okay. And then your sleep patterns. Tell me about how many hours on a typical night that you sleep.
Typically, I sleep anywhere from 6 to 8 hours. I may go to bed late, but I try to get a minimum of 6 hours and preferably 8 hours.
Okay. And do you have anything that you take for like a sleep aid to help you sleep at night?
I do not. I just get tired and go to sleep.
Do you have trouble falling asleep? Or do you
Sometimes I
have trouble staying
do.
asleep?
It depends on what's all on my mind. If I'm thinking about and anticipating getting up to go somewhere the next day, I sometimes will have a hard time falling asleep. But usually it's not a major problem to fall asleep once I get in the bed.
Okay. And you don't have any issues staying asleep once you're asleep?
Nope, not normally. If I get up to go to the bathroom, I usually can fall right back asleep when I get to the bed.
Okay. And do you typically feel rested when you wake up in the mornings?
Most of the time.
Okay. And then we're going to talk about diet really quickly, as far as like what you would typically, or your typical daily dietary intake. So in the last 24 hours, can you kind of remember some of the things you've had since? This will probably be yesterday, afternoon, evening. So just like dinner yesterday, breakfast, lunch today.
Okay.
It's not quite dinner time.
Last night for dinner, I had homemade vegetable soup. I had a couple of small bowls of that with some oyster crackers, a few. And then today, I don't usually eat breakfast, but I did eat breakfast this morning, and I had about a tablespoonful of scrambled eggs with a few little ham cubes in that, a small link pork sausage, about 2 bites out of that, and an egg roll. That was breakfast. And then for lunch, about an hour ago, I finished lunch, and that was 2 short pork ribs and a small serving of potato tots.
Okay. And immunizations, as a child, do you remember having any immunizations?
No, I had measles. I had the measles and chicken pox, and I don't know if those vaccinations were even available to me in my early childhood, in the early 50s to mid 50s. But I did have chicken pox and measles, and I believe I had the mumps. And then in high school, I think I had a smallpox vaccination sometime in 67 to 69, somewhere in there.
Okay. And then have you had any adult immunizations? That would be things like flu shots, COVID-19 shots, Pneumovax for pneumonia.
I've had regular flu shots, but I have not had the COVID. And that's basically the only vaccination I get would be the annual flu shot. And I only started doing that about maybe 10 years ago.
Okay. And then preventative screenings, do you have any screenings that you get regularly or annually? Blood work, eye exam, dental, mammograms, colonoscopy, things like that?
Dental, routinely, every 6 months. Eyes, I need to go. I have not been to an eye doctor, but that's on my agenda to do soon. And I have an annual mammogram. I have an annual gynecological visit and pap smear. And every 2 years, I have the bone scan. As a result of having been diagnosed with osteopenia, I still do that every couple of years to stay on top of that. And what else?
Colonoscopies?
Yes, colonoscopies. I had my first one probably 15 or so years ago. They told me to wait 10 years, and then I went back after the 10-year mark and had another one, and they told me to come back in 5 years. So that's coming up any time. I think it is in 2021, so that's due shortly.
Okay. And then blood work, do you get blood work routinely?
I have not.
When's the last time you had blood work?
Blood work, I'm scheduled for about 3 weeks out is a routine blood work, but I had never had any blood work done on a routine basis until about 6 months ago. But I realize the importance of that, and will continue to do that.
Okay. And then we're going to talk about your family a little bit, just family history as far as, and we're going to do 3 generations. This is going to be you, your mom, your dad, and then mom's mom and dad's mom and dad. So go back to your grandparents. Start with your parents first. Start with mom and then do dad. Just tell me any health history that's pertinent as far as if they're living, how their health is, or if they've already passed, how they passed, and how old they were when they passed.
My mom is still living. She's 92 and a half. In a few years back, she was like borderline diabetic. She never did take medication. She just, I take that back. She did start taking medication probably in the last 20 or so years, but she's still living and is 92 and a half. My dad died at 82 and a half, and his heart was very healthy. He was healthy. He had good blood pressure. He did not take medications. He died as a result of a job-related matter, I'm pretty sure, because he wasn't diagnosed, but he had the symptoms and the signs of mesothelioma, and he just kind of went downhill. His mother died at the age of 82, I think it was, when she died, and she was healthy all of my remembrance, all of my young childhood years until I was 12, and she passed when I was 12 years old, and she died of toxemia. And then her husband died before I was born, so I really don't know anything about him on that side, on my dad's side. My mother's mother was a small lady, and she had good health pretty much all of her life, but from at the time of her death, she was just over 70, and she died from a stroke. And a couple of my aunts also died at a young age, and they as a result of a stroke. Okay. And my grandfather on my mother's side, I don't know a whole lot about him, but I think when he died, he was around 70 or 71 also, and I believe his was from a heart attack, if I'm not mistaken.
Okay. And then, so education-wise for you, talk about your highest level of education.
My highest level of education was 12th grade, high school, and then I went 1 semester or 2 semesters at night and took a couple of college classes, and I did not go on to continuing in college. I took a real estate course in 1976 and passed it and started selling real estate in 1977. So I have my real estate license, but no college degree.
Okay. And what is your occupation? Are you retired?
I am semi-retired real estate broker.
Okay. And then your marital status?
Married still, almost 48 years.
And do you have any children or dependents?
4 girls and 10 grandchildren, none of whom are dependents. They're all on their own.
Okay. And then type of housing that you live in?
We live in a 2-story home that we own on 20 acres with a pool and too much house for 2 people.
Okay. So it's just you, you said it's just you and your husband that live there?
Right.
And then do you have, as far as financial resources, do you have the resources you need for necessities? Do you have health insurance?
We have health insurance from the state of Florida, Blue Cross, Blue Shield, and we also have Medicare. And yes, we're financially sound.
Okay. And then as far as religion goes, do you have any religious beliefs or needs that would make you withhold any kind of medical treatment?
No religious restrictions on accepting medical care, no.
Okay. And do you, what kind of social interaction do you have typically?
Family, family, and family. That's basically it. We go out to eat a lot, especially since it's just the 2 of us, that we eat out very often. and then do, events and go to and visit with our grandchildren and our daughters. And that's basically we don't travel much. Once in a while, we'll hop in the car and decide to go off somewhere for 2 or 3 days, but that's it.
That was my next question. Any traveling that you do? You don't do any regular far off traveling necessarily?
No, we do not. We don't travel outside the United States, and very seldom do we even go outside of our county.
Homebodies.
Yeah.
And then the last one is which Erickson stage of development that you would fall into, and you would fall into stage 8, and that is the maturity stage. Is the very last stage in the Erickson's developmental model. And it's just when a person, it's in your age group, and you get to a point where you start overlooking, or you look back at your life and you either have this feeling of acceptance or despair over how you've lived your life. So I feel like you are accepting of your life, you're accepting of who you are as a person, and you're proud
Happy
of
in
your
my
life.
own skin.
Yeah, and you're
Yeah.
happy with the life that you've lived. So
Absolutely.
and we're done.